What the ERAMHOPK is this? Wait, what did I just say? I should have known that I was going into the deep end when my diagnosis and treatment were both acronyms. I'm Laura M., an IVF patient, fertility coach, and founder of embee Health. I'm here to give you the secret code to what they're saying on social media and in your clinic. So let's dive in. Let's start with some universal terms that aren't just used in fertility treatment. So acronym number 1. TTC stands for Trying-to-conceive. Essentially, people are describing the entire process of trying to get pregnant and have a kid. Now, they could be in treatment, they could be doing it on their own, could be their first kid, or it could be their 5th kid. But it describes the entire process of trying to make it happen. You might hear people say like, oh, I've been TTC for 3 years. So essentially, they've done this for 3 years. For me, it's kind of become more of a thoroughly tiring chore where I just spend all my time thinking about it. I have a schedule. There are performance reviews, right? You gotta really perform on time. So it's hard to keep up the enthusiasm, certainly. So hopefully I don't get written up for that. Acronym number 2, CD1. This stands for Cycle Day 1. So essentially it's the first day of your menstrual period or your monthly cycle. Your doctor cares about this because they want to know when they can do certain forms of treatment. So my doctor might send me an email saying something like, report CD1 so we can schedule your ultrasound. Acronym number 3, OPK, stands for Ovulation Predictor Kit. So these are those little test strips you can use to check for something called luteinizing hormone, or LH, in your number 1. What that LH tells you is that you're gonna ovulate in about 12 to 24 hours. So it's good to tell your doctor or plan some special time with your partner. The LH doesn't guarantee that you're ovulating. So if you're not sure if you're ovulating, it's really good to talk to your doctor because that's a treatment that they can work on. Your doctor might say something like plus sign OPK. What they're basically saying is report when you have a positive ovulation predictor kit in order to go to the next step. So I used it for things like an IUI and to try naturally. Now let's talk about some of the common hormones and diagnostics that happen early in treatment. Acronym number 4, AFC, stands for antral follicle count. So this is an ultrasound that your provider will do early on in your menstrual cycle to count the immature follicles that are growing. And it gives them a sense of how many eggs are in your ovaries and how you might respond to stimulation medications. For example, in my case, I had an AFC of 10. So that meant they counted 10 of those immature follicles before they pumped them full of drugs in order to make them all mature. And so through my several egg retrievals, I never quite got more than that number, but got close to it. So it was actually a pretty good indicator. Acronym number 5, AMH, anti-Mullerian hormone. And so this is a hormone that's in your blood that they can use to look at your ovarian reserve and get a sense of how you respond to stimulation medications. So a different diagnostic that finds out similar things to the AFC. The AMH, it changes throughout our lifetime, and so that means your number is kind of change as you get older. But in general, the higher the number, and more quantity of eggs you have in your reserve. The thing to remember is that it doesn't really predict pregnancy. You can have a low AMH and still be really successful in going through IVF. Acronym number 6, FSH, stands for follicle stimulating hormone. This is another hormone in your blood that they can test for, and it relates to a lot of aspects of reproduction in both men and women. In women, it can help drive ovulation and also follicle growth. Shocker, right? In men, it can actually affect the production of those swimmers. So both partners will get tested for this. Acronym number 7, HSG, stands for give me a second here, hysterosalpingogram. I hope I said that right. It's essentially an X-ray that's done using contrast dye. They'll use a catheter to put that dye into your uterus and fallopian tubes to basically look for things like blockages or ruptures or, shapes or biology that might be messing with your ability to get pregnant. So that's things like fibroids, polyps, ruptured tubes, abnormally shaped uterus. And these are all things that can affect your treatment and what might be successful. Now let's talk diagnoses. Acronym number 8, DOR. DOR stands for diminished ovarian reserve. So essentially it's a kind of general term describing a woman who has a lower quality or quantity of eggs in their ovaries. Women are born with all the eggs they'll ever have. And so as we age and we have menstrual periods, our reserve declines. What's interesting about DOR is there's no universal definition that's used by every clinic, but there are some key markers that they look for. So they are likely older women who still have their period and have probably a higher follicle stimulating hormone, a lower anti-Mullerian hormone, and a lower antral follicle count. Now, I'll say I don't feel all that diminished at 40 years old. I feel pretty damn outstanding and resilient for going through this process and surviving all that is infertility as an older lady. But it's not stopping me. Acronym number 9, POI, or premature ovarian insufficiency. This affects about 1% of women under 40, and those who do have it normally don't find out until they're trying to get pregnant and conceive and are unable to and seek professional help. This diagnosis is usually given to women under 40 who are having symptoms that look like they've been through menopause. For example, their periods might be irregular or have stopped, their ovulation has stopped, their estrogen is on the lower side, and their FSH levels match the levels of postmenopausal women. Acronym 10, RPL, is a shorthand for recurrent pregnancy loss. You might have RPL if you've had 2 or more pregnancy losses. Mention this to your doctor because they'll go through additional screening. So they'll look at both you and your partner and look at things like your genetic history, your immune system, your hormone levels, and much more to try to analyze what's happening, because you're able to get pregnant but not able to bring those pregnancies to term. Now, I didn't even realize this was a diagnosis. I just thought I was a really unlucky person. It turns out that my doctor, by looking at this diagnosis, was able to kind of rethink my treatment plan in a way that really focused on that. Acronym 11. MF, or MFI, stands for male factor infertility. And it's exactly what you think it is. It is a diagnosis that says the primary reason for the infertility is from the male partner. Now, in most of fertility treatment, you'll see a lot of focus on us ladies. We have some pretty complicated engineering down there, and it takes a lot more work to get to things like the eggs and figure out which part of the system is working or not working. But the thing is, in half of the cases, the swimmers and the eggplant, part of the challenges. It's really, really important. Please, please, please make sure both partners are getting tested, because there's a 50-50 chance that it's one or both of you impacting the process. So now let's break down all those fertility procedures. First, a quick word from today's sponsor. I founded embee Health because I know firsthand how difficult this journey is, and I believe every family deserves more support. There's so much more to managing this process than what medication to take at what time. embee Health really aims to bridge the gap between these clinical demands and this kind of energy and almost second job we have to go through as fertility patients. with the rest of our everyday lives, our families, our social lives, and even just our own mental health. Sign up for a free coaching consult to find out how you can take control of your own experience and be happy and as healthy as you can be in this time. So now let's break down all those fertility procedures. Let's start with the big one, acronym number 12, IVF, or in vitro fertilization. What's interesting about IVF is it's not just, one procedure. It's actually a series of procedures that go from getting the materials to create an embryo, creating and growing that embryo, and then putting that embryo back into the human body to grow into a baby. In stage 1 collection, both partners are on the hook. We need to get the materials that make a baby. So that means things like collecting those swimmers and also collecting eggs through things like an egg retrieval. You might also just be going to the freezer because there's already some eggs or swimmers that are frozen. Stage 2 is the fertilization and what's called embryo culture. This is the magic that happens in the petri dish when swimmer and egg meet each other and create a baby. Yes, it's not technically a test tube, though they do eventually get stored that way. And then in the last stage, transfer, that's when that embryo is returned to the body to attach to the uterus and hopefully grow into a baby. Acronym 13, IUI. IUI stands for intrauterine insemination. So unlike IVF, where things are happening outside of the body, in an IUI, fertilization happens inside the body thanks to a catheter. You're going to notice these treatments use catheters a lot. And there's a lot of timing in order to get the swimmers to the egg's front door so that they can meet and make the magic happen. Now, sometimes women will take medication to result in multiple eggs being released during ovulation, meaning more chances for a pregnancy. This also means more chances for multiples. Acronym 14, an RE or an REI is the reproductive endocrinologist. These are the doctors who make the magic happen for us and give us these chances. REs are trained as OBGYNs. And they end up going through additional training or fellowships, research, looking at endocrinology. So essentially the systems in our body that make and move around the hormone. So this is a big reason why REs use hormones to control our reproductive system, because that's what they're trained to do. Acronym 15, Stims. Now, it's not technically an acronym, but you're going to hear it thrown around a lot. So STIM stands for stimulation phase or ovarian stimulation, follicle stimulation. You pick your exact phrase used in your clinic or that you've heard around. STIMs really refers to the period where we're trying to grow a lot of follicles and a lot of eggs at once. This is a key component of IVF in the early stages, or if you're doing egg freezing, it's the period before an egg retrieval. STIM sort of refers to the whole process of injecting medications at home, attending monitoring appointments, maybe every few days or every day, in order to measure the follicles as they're growing, to kind of get a sense of how well those eggs are maturing inside the follicles. This process typically lasts about 2 weeks, give or take. A lot of that depends on your treatment, how you're responding or not responding to medication. For example, you'll hear someone say on forums like, oh, I started Stims yesterday, which means they just started the process of injecting medications and growing and maturing all those follicles. Acronym 16, ER, or what stands for egg retrieval. This is that big boy procedure when we're collecting all of the eggs that were grown during the stimulation phase. I kind of think about an ER as like an egg raid by the doctors where they're going in and stealing all the eggs we've been growing. I don't know why, I really love the metaphor. What happens after Stims is the doctor needs a way to collect all of the eggs that they've been growing inside of your body. What they do during this procedure is they use an ultrasound to kind of figure out where exactly the follicles are. Meanwhile, they use a long needle to kind of poke into each follicle and draw out the fluid and the little egg that's floating inside. Now, what they do next sort of depends on what your treatment plan is. So if you're in IVF, you're going to end up then moving to fertilization and culture in that petri dish. But if you're just doing egg freezing, they'll end up kind of assessing the egg and they will freeze all of the mature eggs for later use. Acronym 17, FET, or FET, stands for frozen embryo transfer. Now, not all transfers are frozen transfers. What happens prior to a FET is the embryologists thaw the embryos, essentially bringing them back to life before then using a catheter to insert them back into the woman's uterus. Frozen transfers can be natural, where they're really just looking at your hormones and how your uterine lining is going, or they can be programmed or medicated, where essentially you're taking medication to make sure that your body is in the right kind of place, right? You have a nice thick uterine lining, your hormones are in a good spot so that it will accept then the embryo. There's no better way to do it yet, but I know there are studies out there that are looking at that. Acronym 18, the beta, or what's also called bHCG. So beta is the blood test that proves you're pregnant. Holy crap! When you test at home, you are testing for HCG when you pee on a stick, testing your number one. And so when you test your number one at home, what you're testing is that same hormone, HCG, the human chorionic gonadotropin. This is a hormone that is unique to pregnancy, and that's why they test for it. When you do the blood test, what happens is they're looking at the specific volume of that hormone in your blood. You actually get back a number that says how pregnant you are. And it's something where they actually repeat the test over multiple days to ensure that that hormone is increasing at a rate that suggests a healthy pregnancy. And here's a fun fact for you. It's called beta because HCG is actually a really complex hormone with multiple kind of subunits to it, the alpha and the beta. And so the alpha unit actually shows up in other hormones, but the beta subunit is unique to HCG. So when they test the beta, they know that they're testing only the HCG hormone. Lastly, let's talk time. Fertility treatment is full of waiting periods, and we have a few ways we tend to describe them. Acronym 19, DPT. This stands for days post-transfer. And you'll see a few different flavors of this, so you might see different forms. There's also a sister acronym called DPO, days post-ovulation, that tends to be used by people trying on their own. Essentially, it's describing the period of time or how long you've been waiting since a transfer. It doesn't matter if it's a fresh or frozen 3-day or 5-day. And people will embed that information in the acronym. Let's say someone is in a forum and they're trying to get advice, and it's been 5 days since their 5-day transfer. And maybe they're wondering, should I be having symptoms yet? Or I think I'm noticing this. Does that mean it worked or not? Rather than type all of that out, it's a mouthful even to say, we'll use a version of the acronym. What someone would write is 5DP, 5DT. The first 3 letters refers to how long it's been since the transfer. The other 3 letters refer to the type of transfer it was. So this way, we all know the context of where someone's coming from and a lot less letters. Acronym 20, TWW or 2WW stands for the 2-week wait. This is a description of that gut-wrenching time between ovulation and IUI or transfer until your doctor encourages you and asks for a pregnancy test. In this period, you're both pregnant and not pregnant, a little bit like Schrodinger's cat, and you won't really know until you test. And even after you test, there could be a lot of changes in that first trimester. Unfortunately, there's little to do except act like you're pregnant. Eat healthy, stop alcohol, and take those prenatals until you get answers from your doctor. What it should really stand for is torture, whiplash, and worry. I'm wrestling with feelings about, did it work? Did it not work? And then you'll feel symptoms, and then you won't feel symptoms, and then you worry about it working at all. It's crazy making, and we just have to suffer through it. That's it for today. I had a huge pile of acronyms that I could have gone over, and it was hard to choose. And I really hope that helps you translate some of what's going on around you. Let me know in the comments if there's any acronyms you want me to cover in the future, if you'd like to see another video like this. So please subscribe for more videos and like this video so other folks can find it in their research. I'll leave you with a fertility fun fact. In 2024, scientists announced that they had a successful IVF round for a southern white rhino. What's crazy about it is it took 13 cycles to get to a successful transfer. I guess we're not the only ones on the struggle bus. So take care and bye-bye for now.